Kia ora koutou katoa, e mihi mahana kia koutou. Ko taki te mutawaka, ko mau te maunga, ko Ngāti Rangi Nui, me Ngāti Rangi o ko iwi, o tauranga moana hau. Kia ora, I am Puea Winiata. I am the CEO of Turuki Healthcare in Taumaki. I'm looking forward to a future where whānau can determine and define wellness for themselves. I'm looking for an opportunity to see how the health system can be heavily weighted to primary health care and prevention, that there are heaps of choices for whānau to go to Māori providers to deliver their care, but if they need to go to non-Māori providers, then they also feel safe in that environment. I think for us the future will be a future where there is a heavy reliance on relational care, in that a whānau will feel and experience a very close working relationship with their healthcare provider, and that they feel that they are in a space where they're managing their wellness rather than their illness. I think what we need to prioritise over the next 25 years is consider te wharitapa whā. Often when we're looking at the development or delivery of health services, the biggest unmet need for whānau is te taha wairua, and how te taha wairua integrated with all of the other domains will improve our wellness as individuals and within the whānau. I think over the next 25 years we need to look carefully at the roles that we need in the Māori workforce. We need to be looking towards our future state to ensure that we have the workforce coming through. I would like to think that a lot of our rangatahi are encouraged and excited about working in the area of health and well-being, and that we get fresh ideas, fresh energy, but not to create the same system and the same kind of roles, but new roles. I think over the last 2 years our experience with COVID has been really valuable. What that has done is enabled better working relationships with Māori. It has loosened up all of those things that get in the way that may have been important in a policy setting 20 years ago, but now they are unimportant. We actually need to move more flexibly, with agility, that actually better meets the needs of whānau and is far more responsive rather than reactive. I think for us, the COVID situation has really built relationships like we've not had before on the digital platforms. We've had to quickly upskill the way in which we deliver services, and those services online have really reached into whānau in a way that we've never been able to reach before. We need to become experts in relationships. We need to have intelligent relationships across the system. We need to have clever relationships. We need to have visionary relationships. Often the systems are in place that enable things to happen, but unless the people who manage those systems are in positive, forward-moving relationships, it's very difficult, and often we get really stuck. A focus on sharing data is another area. I know, for example, in our current context, a lot of information sits languishing in the DHB or languishing in the Ministry of Health. We need to get that data out about our own people in order to figure out how that information will enable us to accelerate or be more responsive in the way in which we deliver services to whānau. More importantly, whānau need to have access to the information that impacts on them and is about them. And I think we've got some good things in place at the moment, but we need to accelerate those things that will enable whānau to be in charge of their own health and well-being. Wellness needs to be considered in its broadest scope, but we need to understand what's important and what the priorities are for whānau in defining their own wellness.